The Trump administration has signaled that it wants to change many of America's social safety net programs. One of its main ideas is adding or expanding the requirement to work in exchange for benefits. In tonight's signature segment, NewsHour Weekend's Megan Thompson went to Maine, which already has work requirements for some aid programs. It's also at the center of a debate whether these provisions genuinely help those in need. The story is part of our ongoing series about poverty and opportunity in America, Chasing the Dream.
In a rural pocket of Maine, east of Augusta, 50-year-old Tim Keefe lives in a Spartan two-room trailer without a bathroom or even running water. A Navy veteran, he's single and has two grown daughters.
We don't need too much refrigeration this time of year. But
his only income is about $200 a month in food stamps.
You have to kind of figure out what you're going to need for each day and what you can get away with. You're not eating like a king, but you're eating, so that's the important part.
But not too long ago, things were even more difficult for Keefe. He was working at a manufacturing plant when he suffered a wrist injury that required multiple surgeries. He lost his job and then his home.
In here, this is where I spent last winter.
For a time, Keefe lived in a small tent warmed by an electric heater.
You're basically stuck in the tent when it's really cold. It's just, it's survival.
Adding to the hardship, Keefe had no access to food stamps. That's because beginning in 2014, if you were under 50 and you weren't caring for children, Maine started enforcing a 3-month time limit on food stamps, unless you were working 20 hours a week, volunteering, or in a job training program. Keefe could do none of those things with his injured wrist, and he was under 50.
You wake up in the morning, you're a caveman. You got to go find food. You got to gather. You got to hunt, you know. And I tell you, when you haven't eaten in a few days, your morals are out the window. You know, hitchhiking to the supermarket and robbing the supermarket for food became an option, a viable option.
Keefe estimates he lost 40 pounds during the 10 months he went without food benefits. Then he turned 50 last May and became eligible again for food stamps, also known as the Supplemental Nutrition Assistance Program, or SNAP.
I've gained it all back. I mean, the SNAP program is a lifeline. It really is.
It is not in the best interest of anyone to just simply hand out a check.
Mary Mayhew was the commissioner of Maine's Department of Health and Human Services from 2011 to 2017 under Republican Governor Paul LePage. She says the state was ripe for reform when she took over administration of its safety net programs.
The department had truly lost sight of its core mission. The work underway was focused on trying to be all things to all people. Success was defined by the number of people coming on to welfare rather than the number of individuals who were on that pathway to self-sufficiency and independence.
Under Mayhew, Maine looked at the wage records of nearly 7,000 adults without dependents, people like Tim Keefe, in the 1 year after food stamp benefits were cut off.
Individuals left food stamps, went back to work, and their incomes increased by over 114%. They were earning more than the federal poverty level, exactly the goal that we certainly hoped for as we incentivized and prioritized work.
And the Trump administration has taken notice. Citing Maine's changes to its SNAP program, in April, President Trump signed an executive order directing federal agencies to strengthen and introduce work requirements. Mayhew, meanwhile, has left her position in Health and Human Services to run for governor in the Republican primary. She's also consulted with the Trump administration about Maine's experience with work requirements.
I'm incredibly proud that Maine is seen as a model.
Maine is not a model. It's a cautionary tale.
Chris Hasted is the Public Policy Director for Maine Equal Justice Partners, an advocacy group representing low-income Mainers.
Things are not going in a good direction, and for those who argue that these so-called reforms are effective in helping to raise families out of poverty and improve their ability to support their families, it's just not happened.
Hasted notes that the same study on food stamp changes in Maine touted by Mayhew and the Trump administration is not all positive.
2/3 of people that had been terminated still did not have employment. That's about the same that didn't have employment at the beginning of the year. But now, at the end of the year, they had neither wages nor food assistance.
She says forcing people to work ignores the barriers often faced by many low-income people.
Jobs aren't available, or the hours aren't available, or transportation isn't available, or childcare isn't available. But none of those factors are considered in these inflexible policies that say you either work 20 hours a week or you don't get food.
Hasted also points to federal data showing that since 2011, Maine has seen food insecurity, which measures access to food, increase by nearly 9%, while the national level has declined by about 11%.
This is just part of this ideological march toward a policy that is not going to be effective and is only going to create more hardship for people who are impacted by it. That's what we've seen here in Maine, and that's what we would expect to see from a similar policy in Medicaid.
Medicaid, which provides health care for low-income Americans, is jointly administered by states and the federal government. Last year, Maine asked the federal government to add work requirements to Maine's Medicaid program. Ricker Hamilton is the state's current Commissioner of Health and Human Services, which oversees Medicaid in Maine. He supports adding work requirements to the program, which is known as MaineCare.
We didn't have these tools for the people, so they only had the welfare benefit, they only had MaineCare services. So they were kind of stuck. And I think by helping people who are able and want to work, it's enhancing the program and improving the program.
The state wants to make MaineCare more like its SNAP program. Among other changes, it wants to require able-bodied adults, including those with children over the age of 5, to work at least 20 hours a week, volunteer, or be in job training. Maine is one of 7 states with pending requests for similar measures. Kentucky, Indiana, and Arkansas have already had work requirements for Medicaid approved by the Trump administration. Hamilton says the state's economy is healthy and has jobs available.
This is a golden opportunity that hasn't existed in a very long time, and I think it's time for us to step bravely as opposed to fret, wring our hands and shake our heads and say, what if? We need to take that step forward.
Hamilton points to the state's experience with yet another social safety net program, the original Welfare to Work program promoted by President Bill Clinton in the 1990s. It's called Temporary Assistance for Needy Families, or TANF. In Maine, to qualify for TANF, a recipient must have low or no income and be caring for a child. In order to help those recipients get jobs, the state provides not only cash assistance, but also subsidized transportation and childcare, as well as personalized support and job search classes.
I presume everybody in here has a resume.
Classes like this one near Augusta are mandatory for most recipients, and Maine enforces a firm 5-year term limit for receiving TANF benefits.
Big good deal. Yeah. Got lucky.
28-year-old Michelle Young received a little less than $300 a month in TANF cash assistance off and on for almost 14 months before and after giving birth to her daughter.
I hadn't worked in years, so your confidence is down a little bit. And it's really, it's embarrassing to have to ask for help. It's embarrassing to have to receive TANF.
Young got a job as an administrative assistant working with a nonprofit that helps TANF recipients. She credits the support she received and the requirement to find employment with helping her get and keep a job.
You know, the accountability, I needed it.
Maine is now launching a pilot program for 500 households to offer similar work supports to SNAP recipients.
It might be good to get you set up with a pulmonologist now that you have MaineCare.
Dr. Renee Fay-LeBlanc is the Chief Medical Officer at Greater Portland Health, where about 35% of its nearly 11,000 patients are on MaineCare.
MaineCare is important for people to be able to get to the place where they can work, provide for their families.
Maine estimates that eligibility for MaineCare will decline as a result of the new work requirements. Dr. Fay-LeBlanc says the consequences for losing access to MaineCare can be life and death.
I had a patient who did not have MaineCare. He was having a lot of symptoms that hadn't been explained yet or diagnosed, and yet he refused to go to the hospital because he didn't want to rack up more medical debt. And that patient died last year. And I firmly believe that if he had had access to MaineCare and could have gotten his medications and a real thorough workup for the symptoms that he was experiencing, he wouldn't have died.
Maine today is considered an absolute national leader.
Mary Mayhew has made the changes she oversaw in Maine's social safety net programs a pillar of her campaign for governor. She says asking able-bodied recipients of SNAP benefits or MaineCare to work is not about shrinking the programs or punishing those who need help.
This is not about saving money or being punitive. It is about recognizing that work and employment restores human dignity. I am far more concerned about the tendency of these programs to cast a wide net and trap people than I am that someone is going to fall through the cracks.
Tim Keefe says he fell through the cracks after getting injured. His wrist is now strong enough for him to work, but he struggled to find a job.
They say there's, a lot of open jobs and people are really looking for work in this day and age, but I've pounded the pavement for 9 months and I can't get hired. I've never had such a problem getting hired before in my life.
Using money from a workman's comp settlement, Keefe purchased some land and he's hoping to build a small house using found timber. And for now, he still gets SNAP benefits. But last month, Republicans in Congress proposed raising the work requirement and job training age from 49 to 59 for SNAP recipients as part of the Farm Bill, meaning Keefe, as a 50-year-old, could again lose access to food aid.
There has to be some vehicle for poor people to eat. You can't just starve them. You can't do that.
The House of Representatives is expected to debate and vote on the 2018 Farm Bill before the end of the month.